Ever feel like you need to get a handle on something important, but there's just so much info out there, it can feel overwhelming?
Yeah, we get it.
That's why we do the digging for you. Today, we're tackling a really common health issue for cats. Feline Calicivirus. FCV for short.
Right. And this is relevant for so many people listening, whether you actually own a cat or maybe you work with animals.
Or you're just curious about animal health generally.
Exactly. Understanding FCV really gives you a window into, well, the challenges of viral diseases in animals.
For sure. So to give you the best info, we've looked through excerpts from a feline calicivirus infection guide. Our mission for this deep dive, simple. Pull out the key facts, the essential insights, so you walk away really understanding this virus and what it means.
I'm good.
Okay, let's start right at the beginning. What exactly is feline calicivirus?
Okay, so feline calicivirus, or FCV, is basically a really common virus. Mostly causes respiratory problems in cats, domestic cats, but some exotic ones too.
Respiratory, okay. Like a cat cold.
Well, yes and no. What's interesting and what the guide points out right away is how much it can vary. You get the typical upper respiratory signs, runny nose, that kind of thing. But it can also cause things like ulcers in the mouth, pneumonia, sometimes even arthritis, joint inflammation.
Arthritis from a respiratory virus.
Yeah. And in really serious cases, it could even lead to this systemic disease, involves hemorrhaging, and that can be fatal.
Wow, okay. Fatal. That's definitely more than just a sniffle. So how does it do that? How does one virus cause such, a wide range of issues? What's happening inside the cat?
Well, the guide explains it works through something called cytolysis. Basically, the virus gets into cells and destroys them very quickly.
It kills the cells.
Pretty much. And that cell damage, that tissue damage, is what leads to the illness signs we actually see. The virus hijacks the cat's own cells to replicate and just messes everything up in the process.
Okay, makes sense. And this damage can show up in different body systems, right? The guide breaks it down. Let's talk gastrointestinal first. Tongue ulcers came up.
Yeah, tongue ulcers are super common with FCV. Really characteristic. Sometimes you might see them on the roof of the mouth, the hard palate, or maybe the lips.
Any other GI stuff?
Well, the virus can infect the intestines. But interestingly, the guide says that usually doesn't cause any symptoms you'd notice.
Huh. Okay. Then there's the hemic and lymphatic systems, blood and immune stuff. The guide just mentions hemorrhage. What does that imply?
It points to the potential for bleeding. It's usually linked to those really severe systemic forms of FCV we mentioned. The virus can basically interfere with blood clotting.
Not good.
Definitely not.
Yes.
Serious complication.
All right, musculoskeletal system. Acute arthritis, that sounds sudden and painful.
It absolutely can be. We're not talking about the slow chronic arthritis some older cats get. This is like a sudden onset lameness, really painful joints, directly because of the viral infection.
It's just wild how a respiratory virus connects to joints like that.
It really shows how viruses can have unexpected systemic effects.
Okay, and the eyes. Acute serous conjunctivitis, the guide says.
Right, so that's inflammation of the conjunctiva, the sort of pinky membranes around the eye. But importantly, it usually doesn't involve the cornea, the clear part. That's the without keratitis bit.
Got it. And finally, the respiratory system itself. This is where we'd expect issues.
Exactly. So rhinitis inflammation inside the nose, interstitial pneumonia, which is more serious, affecting the lung tissue itself. And you can even sometimes see ulcers right on the tip of the nose.
So yeah, quite the range. Who tends to get this? Are some cats more vulnerable?
Well, the guide says all cat species can get it, but where we see the actual illness most often is in young kittens, particularly over 6 weeks old.
Immune system still developing?
That's likely a big factor, yeah. But it's really important to stress any cat, any age, can get infected and show signs.
Okay.
And the environment is huge. FCV is way more common in places with lots of cats together. Think shelters, breeding catteries, anywhere there's close contact.
Makes sense. High density equals higher transmission risk. So if you have a cat at home, what are the signs you should be watching for? What are the red flags?
Often, it starts pretty suddenly. A big one is loss of appetite, anorexia. They just stop wanting to eat.
Okay.
You might see eye or nose discharge. But interestingly, the guide notes often there's not much sneezing, unlike some other cat colds.
Well, that's a useful distinction.
It can be. And then the ulcers are a really key sign. On the tongue, roof of the mouth, lips, nose, sometimes even around the claws, though that's less common.
And on the claws, wow.
Yeah. Difficulty breathing, that kind of labored breathing, that could mean pneumonia is developing. And that sudden lameness we talked about could be the arthritis. Plus, fever is common too.
And you mentioned earlier, sometimes the ulcers might be the only obvious sign.
Exactly. Sometimes a cat might just seem a bit off, maybe not eating well, and then you spot ulcers in the mouth, even without major respiratory signs. It's definitely something to look for.
Good to know. Okay, so we know what it is, how it affects cats, what causes it biologically, and how does it actually pass from cat to cat?
So the virus itself, it's a small, single-stranded RNA virus, and importantly, it's non-enveloped.
Non-enveloped. What does that mean practically?
It means it doesn't have that outer fatty layer some viruses do. That actually makes it tougher, more stable in the environment. It can survive longer on surfaces and is resistant to some common disinfectants.
Oh, okay. So harder to kill.
Can be, yeah. And another key thing, there isn't just one FCV. There are tons of different strains out there, and they vary. Some cause mild illness, others much more severe. There are different serotypes, too, meaning their surface proteins look slightly different to the cat's immune system.
So it's a shifty target, in a way.
You could say that.
Yeah.
As for spread, the guide hits on a few risk factors. Not being vaccinated or not having the full series is a big one.
Yeah.
Those multi-cat environments, obviously. Being infected with other cat viruses at the same time, like feline herpesvirus or panleukopenia, that can make things worse.
Weakens their defenses.
Exactly. And just poor ventilation can help any respiratory virus spread more easily indoors.
Okay. So let's say a vet suspects FCV. How do they actually confirm it? Is there a simple test?
Not usually a simple one. Routine blood work, like a CBC or chemistry panel, often doesn't show anything specific just for FCV.
So what then?
You need more specialized lab tests. One way is serology, looking for antibodies in the blood. But you usually need 2 samples, taken a few weeks apart, to show a rise in antibodies, proving recent infection.
Takes time then.
It does. Faster methods include virus isolation, trying to actually grow the virus in the lab from swabs, mouth, nose, eyes.
Like a culture?
Kind of, yeah, but for viruses. And PCR is very common now, polymerase chain reaction. That test looks directly for the virus's genetic material, its RNA, in a sample. It's very sensitive.
So PCR finds the virus's fingerprint, basically.
That's a good way to put it. There are also immunofluorescent tests on tissue sometimes. And if pneumonia is suspected, chest x-rays are important to see what the lungs look like.
And they have to rule out other things too, right?
Absolutely. The guide mentions other things that cause similar signs. Feline herpesvirus, that's another big one, chlamydia, bordetella. So diagnosis is often about putting pieces together.
Okay, sounds like a bit of detective work sometimes. What about treatment? If a cat gets diagnosed, what can be done?
Well, this is a key point. Unfortunately, there aren't really specific antiviral drugs that work well against most FCV strains.
No magic bullet.
Not really, no.
Oh.
So treatment is mainly about supportive care, helping the cat's body fight it off and managing the symptoms.
What does supportive care look like?
For most cats who aren't severely ill, they can be managed at home. It involves good nursing, gently cleaning discharge from the eyes and nose, making sure they can breathe comfortably. Offering tempting, soft food is crucial, especially if they have mouth ulcers.
To encourage eating.
Right. If they have severe pneumonia, they might need oxygen therapy at the vet clinic. And keeping them quiet, restricting activity, helps them conserve energy and also prevents spread.
Any medications used?
Yes, but usually not targeting the virus itself. Vets often use broad-spectrum antibiotics.
But it's a virus.
It is, but secondary bacterial infections are really common complications. So the antibiotics are to prevent or treat those. If there's conjunctivitis, antibiotics eye ointment helps. And if they have that painful arthritis, pain medication is important for their comfort.
So it's really about managing symptoms and complications. Since there's no direct cure, prevention sounds even more critical. What's the recommendation there?
Absolutely. Prevention is paramount. And the main tool is vaccination. It's considered a core vaccine by groups like the AAFP, American Association of Feline Practitioners.
Core meaning all cats should get it.
Generally, yes. Usually given in combination with vaccines for herpes virus, FHV1, and panleukopenia, FPV.
What's the schedule like?
For kittens, it's a series. Starts as early as 6 weeks, then boosters every 3-4 weeks until they're at least 16 weeks old, then typically a booster a year later, and after that, revaccination for calicivirus is often recommended every 3 years for adult cats. Now, here's a really important point the guide makes. Vaccination doesn't always prevent infection completely. A vaccinated cat might still get infected if exposed.
Oh. So why vaccinate?
because it significantly reduces the severity of the disease. A vaccinated cat is much less likely to get severely ill, develop pneumonia, or die from FCV compared to an unvaccinated cat. It primes the immune system.
Ah, okay. Protection against serious illness, not necessarily against catching it at all.
Exactly. And the guide also mentions specific protocols for places like breeding catteries, sometimes starting vaccines even earlier, maybe using intranasal vaccines too, because the risk is higher there.
Right, makes sense. What about complications? We touched on pneumonia being serious. Any others? And what's the usual outcome for a cat with FCV?
Pneumonia, that interstitial pneumonia, is definitely the big worry. It can be life-threatening. Secondary bacterial infections are another common complication.
But the ulcers and arthritis.
The good news is those usually heal up fine without lasting issues.
Mhm.
The systemic hemorrhagic form, though, that's very severe and often fatal, as we mentioned.
Okay. How does the illness usually play out time-wise?
Signs typically show up maybe 3-4 days after exposure. Recovery often starts kicking in once the cat's immune system mounts a good antibody response, which is usually around day 7 or so. After that, recovery can be pretty quick for uncomplicated cases.
So, overall prognosis?
Generally excellent,
Yeah.
unless they develop that severe pneumonia or the hemorrhagic disease. Most cats pull through fine with supportive care.
But there's a catch, right? You mentioned something about carriers.
Yes, and this is really important, especially if you have multiple cats. Some cats, even after they recover fully and seem perfectly healthy, can become persistent carriers.
Meaning they still have the virus.
Exactly. They continue to shed the virus, usually in saliva and other secretions, for a long time, weeks, months, sometimes even longer,
Yeah.
even though they show no signs themselves.
So they could unknowingly spread it to other cats.
Precisely. That's a major challenge in controlling FCV, particularly in shelters or multi-cat homes. You can have these silent shedders around.
Wow, okay. That definitely adds a layer of complexity. Well, this has been incredibly informative, a really thorough deep dive into FCV. Let's just quickly boil down the main takeaways.
Sure. I think the big ones are FCV is common, yes, but incredibly variable. It's not just one disease presentation.
Right, from mild sniffles to really serious stuff.
Exactly. And because of that variability in the different strains, vaccination is absolutely crucial, not necessarily to prevent all infection, but to protect against severe illness.
Reduces the risk significantly.
For sure. And finally, that carrier state is key. Recovered cats can sometimes keep shedding the virus, which has implications for spread and control. This variability, it's also why developing one perfect vaccine or one perfect antiviral is so tricky.
That makes a lot of sense. Thinking about how common this virus is, yet how differently it can act, and the vital role of vaccines, it really underscores the ongoing challenge of managing infectious diseases, especially in animal populations. It leaves you wondering, doesn't it? Like, what are the biggest hurdles right now in creating antiviral drugs that can actually tackle such a diverse virus effectively?
That's a huge question in veterinary virology.
And how do those dynamics in multi-cat settings, the shelters, the catteries, how do they really impact the long-term control of a virus like this, one that can hide out in carriers? Definitely some for thought there.